Okay, so welcome back. It has been a while since I have done my last video, but today we're going to look at ethics. First, let's go over what is ethics. Well, in general, it's like morals, where morals is your personal viewpoint of right or wrong, but ethics is actually kind of like a standard of right or wrong. And let's consider, a clinical trial. When is it right for a human to be tested for the results of a medical treatment? Well, only when there's good enough reason to believe that the treatment will help the patients in the trial. Okay, well, when is it okay to use a treatment that does no harm, such as a placebo? Placebo should only be used in comparison to another treatment to identify the results when the results are completely unknown. And we've talked about that in a previous video. Okay. So, the first kind of step of ethics, before beginning your study, you're going to have to write up a proposal and send it to a review board, an institutional review board, or an IRB, and they will have to approve or disapprove it. So let's talk a little more about institutional review boards. Okay. So an institutional review board protects the rights of humans, essentially. And it's not like a one and done kind of job. The review board actually does routine check ins, typically once a year, actually. And a review board can disapprove your entire proposal. However, typically, they will disapprove with some kind of changes, and you can resubmit your proposal for it to go through the review again to try to get approval. Okay. Second part of ethics is before you start the actual study, you must obtain informed consent. Okay. So, informed consent is also needed for surveys. This would be by giving the approximate time, how long the survey may take. You also need to include, what kind of questions will be on that survey. And here is where we talk more about informed consent and what I just went over. Subjects may or may not give you consent. A subject has all the right in the world to deny being in the study. So, the third part of ethics is all the data from your study about the individual must be kept confidential. So, this will include only summary results be made to the public. And there is an extra part of caution I want to put on that because you might think that it is summarized enough. Always consider other individuals going out and pulling other data sources to connect with your results and identify at that point, can my individual be identified if I connect it to another data source. So always think about that as well. Let's go over confidentiality versus anonymity. So, confidentiality is keeping all the data about the individual secret or private to the public. And, you just separate the subjects from the remaining data. The difference between confidentiality and anonymity is that you will be able to still go back to follow up on any kind of questions after the survey, after the results, to kind of improve non responsiveness. And to go over anonymity is when completely the subjects are unknown. This is when we could call them subject A, B, C, or D. We don't know their name. We don't know anything about them. It's not really commonly seen actually in statistical studies. And like I said, anonymity does prevent follow up questions to improve non responsiveness. So, for example, consider you're doing a survey, an individual has actually left 4 of the 6 questions blank. With confidentiality, you may be able to go back and follow up and get those questions answered. So let's kind of see how much you've learned. So With each statement, I want you to think about what is wrong with it, and we'll go over it. The first statement, clinical trials to test medical treatments are always ethical if they randomly assign patients to treatments. No, actually, clinical trials or randomized experiments should only be used when there's good reason to believe that the treatment will help the patient in the trial. The second statement, the job of an institutional review board or an IRB is complete when they decide to allow a study to be conducted. Think about that one. In fact, actually, no. I mentioned this a little earlier. The IRB, the Institutional Review Board, should be doing routinely checks. Normally, it's once a year, at least. And the third statement, a treatment that has no risk of physical harm to subjects is always ethical. Think about that one. What is wrong with that statement? I previously mentioned this, but a treatment such as a placebo that has no harm should only be given in comparison to another treatment and the results are unknown. You want to see which one will do better. So no, it is not always ethical to apply a treatment that has no harm. You must have justification for applying that treatment. All right, so let's just review really quickly. So, of course, before any research can begin, you're going to submit a proposal to the IRB or the Institutional Review Board. The IRB will either approve it or disapprove it with some changes to be reevaluated when you submit it again, if you do. Um, Whenever you're gathering data for an experiment, you must first and always get informed consent. The subject has all the right in the world to deny being part of that survey or that study or experiment. Um, they have the right to do that. And of course, lastly, once you're collecting data and after the data is collected, the data must remain confidential. You can practice anonymity, but it is not commonly used for such cases where you can't actually do any kind of follow up questions.